What does spinal decompression actually do for an L4 or L5 disc bulge? I have helped thousands of patients with disc bulges, and in this video, I'm going to break down exactly how non-surgical spinal decompression works. You'll learn what spinal decompression does to the disc, how it helps the disc heal, and how it relieves back and leg pain without surgery. By the end, you will know if this treatment is right for your situation. I'll also show you what to look for when searching for a spinal decompression doctor in your area. Keep watching. Hi, I'm Dr. Philip Cordova, a chiropractor in Houston, Texas, with 29 years of experience helping people with chronic neck pain, back pain, poor posture, and sciatic nerve irritation. As a chiropractor, I believe the adjustment is the most powerful thing we do, and being specific with it matters, which is why I rely on spinal x-rays to guide every patient's care. On this channel, you'll get simple, specific, and safe strategies you can use at home to feel better fast. I share the same x-ray guided chiropractic strategies, posture fixes, and modern therapy insights I use in my clinic to help patients get long-lasting relief. Subscribe to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. When most people hear spinal decompression, they picture a simple stretch. That is not what is happening. Spinal decompression therapy is a non-surgical, motorized traction treatment. But the real goal is not stretching muscles. It is changing pressure inside the disc itself. That distinction matters, especially when we're talking about an L4, L5 disc bulge. During non-surgical spinal decompression, you are positioned on a specialized unit. That system applies a gentle, controlled pulling force to the lumbar spine. It does not just pull and hold. It pulls, then releases slightly, often around 25%, and then pulls again. That rhythmic pattern is intentional. It creates negative pressure inside the intervertebral disc. Think of it like creating a small vacuum inside the disc. That negative pressure can help draw a bulging or herniated portion back into its normal position. As that happens, pressure on the nearby nerve root decreases. At L4, L5, where disc bulges commonly irritate the nerve and trigger back pain that travels down the leg, even small pressure changes inside the disc can make a meaningful difference. Before anyone starts decompression in our office, we take x-rays. That step is critical. Imaging allows us to see structural changes and disc space narrowing. It also helps us identify any conditions that would require modifying the decompression protocol. Most importantly, it confirms the treatment is appropriate and safe for you. Decompression is not one size fits all. Proper imaging ensures that we are targeting the correct level and applying the correct settings. Unlike older traction systems that relied on constant force, modern computerized decompression cycles between tension and relaxation. This cycling creates a pumping effect inside the disc. Instead of compressing it further, we are encouraging space and controlled pressure change. That is what improves internal disc mechanics. In our clinic, we use non-surgical spinal decompression unit called the Back on Track by ErgoFlex. It is fully automated and delivers precise axial and bilateral distraction. There are no bulky belts or restrictive body entrapment system. Setup takes less than a minute. The patient remains comfortable and supported. The system runs specific program protocols based on what we see on the imaging. It is FDA cleared, compact, and easily combined with other treatments when appropriate. The goal is consistent, repeatable decompression that focuses specifically on disc pressure and nerve relief. All of this matters because the real question is not just whether we can move the spine. The real question is whether we can influence what is happening inside the damaged disc itself. And that pressure change is only the first part of the healing process. Changing pressure inside the disc is step one. Healing is step two. Once we create negative pressure inside the L4-5 disc, something important happens. That vacuum effect does not just influence the position of the bulge, it also improves fluid movement inside the disc. Discs do not have a direct blood supply like other tissues in the body. They rely on movement and pressure changes to absorb what they need. When decompression cycles between tension and partial release, it creates that pumping effect that we talked about earlier. That pumping allows water, oxygen, and nutrient-rich fluid to move back into the disc. This is critical for a degenerated or damaged disc. Improved nutrient intake supports the disc's natural repair process. At the same time, better circulation helps flush out the inflammatory chemicals that build up around the irritated nerve. As inflammation decreases, swelling around the nerve can calm down. That alone can significantly reduce back and leg pain. Another important effect is rehydration. Over time, discs can lose hydration and resilience. With consistent, properly applied non-surgical spinal decompression, we encourage the disc to draw the fluid back in. A more hydrated disc is better able to handle load and daily stress. This is also why consistency matters. Most patients do not come in for 1 or 2 sessions and stop. A typical plan may involve multiple sessions per week over several weeks. Many patients report noticeable relief after the first few visits. That early improvement often tells us that we are affecting disc pressure in a positive way, but sustained change requires a structured plan. After each session, we often recommend simple strategies like icing to help minimize any temporary inflammation. Normal walking and daily activities are usually fine. However, we typically advise holding off on heavy back squats or deadlifts until cleared, especially in the early stages. The goal is to protect the healing environment we are trying to create inside the disc. It is also important to mention that if you have had prior back surgery, timing matters. In most cases, we wait at least 1 year after surgery before considering decompression. Safety always comes first. So when patients say they feel relief, it is not just because their back was stretched. It is because we are changing pressure, improving fluid exchange, reducing inflammation, and supporting the disc's ability to recover. And when pressure on that nerve begins to decrease, that is when the symptoms many people struggle with every day start to improve. At the end of the day, most people are not thinking about disc pressure or fluid exchange. They are thinking about pain. They want to know one thing: will this help my back and leg pain without surgery? When an L4, L5 disc bulge presses on a nerve root, especially the nerve that contributes to the sciatic nerve, it can cause sharp low back pain, radiating leg pain, numbness, or tingling. If we reduce the bulge and decrease pressure on that nerve, symptoms often improve. That is the goal of non-surgical spinal decompression. As pressure on the nerve decreases, irritation decreases. As the irritation decreases, inflammation begins to calm down. And as that happens, many patients notice less radiating leg pain and improved comfort with standing, walking, and sitting. Mobility improves because the body is no longer guarding against that constant nerve irritation. Another major benefit is that in this non-invasive process, there are no incisions, no anesthesia, no surgical hardware, and a typical plan may involve 10 to 20 sessions over 4 to 6 weeks, depending on the severity of the disc issue and how the patient responds. For many people, this offers a structured alternative before considering injections or surgery. That said, decompression is not for everyone. This is why proper evaluation and x-rays are so important. We need to confirm the source of the symptoms. We need to rule out conditions that would change the treatment approach. And if you have had prior back surgery, we typically wait at least 1 year before considering decompression to ensure stability and safety. It is also important to understand that spinal decompression works best as part of a comprehensive plan. In many cases, chiropractic adjustments help improve spinal alignment and mobility, while decompression focuses specifically on increasing disc space and reducing internal disc pressure. Together, they address both structure and disc mechanics. If you are searching for a spinal decompression doctor in your area, look for a provider who takes imaging before starting care, uses a computerized non-surgical spinal decompression system, customizes protocols to your specific disc level, and clearly explains the treatment plan and expectations. Avoid anyone who promises instant cures without proper evaluation. By now, you should understand what spinal decompression actually does to an L4, L5 disc bulge, how it supports healing, and how it can relieve back and leg pain without surgery. The most important step is making sure the diagnosis is accurate and the treatment is individualized to your spine. That is how you determine whether this treatment is right for your situation. The best way to determine if this treatment is right for you is to get a thorough evaluation with a qualified spinal decompression provider. If you found value in this video and learned something new about spinal decompression, like and share it so others dealing with L4, L5 disc bulges can better understand their options. If you have specific questions, drop them in the comments below. Make sure you subscribe to the channel so you can learn more practical strategies to protect your spine, prevent flare-ups, and stay pain-free with clear, actionable tips you can use right away. And if you want to see how we use non-surgical spinal decompression as part of our 5-step process to treat L4, L5, and L5S1 disc bulges, go watch this video next. In this video, I break down the 4 additional layers we combine with decompression inside our multimodal treatment program. Go watch this video next.